Welcome back to 1011 News at noon. Diabetes can be a difficult disease to navigate, but you're not alone. November is Diabetes Awareness Month, and here to share information on local resources is Sarah Burwell, CHI Health Diabetes Educator and Dietitian. Sarah, wonderful to have you on.
Thanks for having me.
Yeah, we're talking about diabetes today. First, I wanted to talk about, can you explain how exactly diabetes affects our health?
Yeah, so I like to explain to my patients, anywhere that blood is going in our body, our diabetes can have an impact, right? The issue with diabetes is we've got too much blood or sugar in our blood. So from your head to your toes, your teeth, your eyes, kidneys, and that can sound overwhelming, but it's important to know the potential risks.
Yeah, really affects everything. And a big thing for me too is knowing the difference between type 1 and type 2. Can you explain that for us?
Yeah, so type 1 diabetes, it's an autoimmune condition. Their bodies have accidentally killed the beta cells in their pancreas that produce insulin. And insulin is what your body uses to kind of keep blood sugar levels from getting too high. Type 2 diabetes is the most common type of diabetes, and for that, their beta cells have, some of them have died, but the other main issue is that they're less sensitive to insulin. It's most common in adults, but we are seeing increasing rates in younger kids.
Which is not what we want to hear. Numbers going in the wrong direction there. So what are some factors for developing diabetes?
Yeah, well, one thing I commonly hear from patients is kind of some self-blaming of it was their weight or what they ate prior to getting the diagnosis, which can contribute, but a lot of things, one thing people don't commonly think of is your genetics. It has a very strong pull in your risk for getting this condition. So if you have grandma, grandpa that already have it, that as well as ethnicity and age as well. Our bodies wear out as we get older.
Yeah, so things that we really can't control there too.
Exactly.
So you can't blame
Take some of the blame off.
Yep. All right, what are the warning signs or symptoms that people could watch out for?
Yeah, so most of the time your body will give you some signs if you're having higher blood sugar levels. Frequently we hear of people complaining of frequent urination, increased thirst or hunger even though you're eating, drinking your normal amounts. You might feel like just really drowsy or blurry vision. Those are some common signs people report prior to being diagnosed.
Okay, interesting. So yeah, if you start experiencing any of those, it's just really important to get them checked out as soon as you can, I'm sure. Yeah. And then also, what are some resources I know that you guys have for people who are diagnosed with diabetes?
Yeah, well, I'll shamelessly plug my own profession. As a diabetes educator, I love to see people come in, no matter like what stage of diabetes diagnosis you're at. If it's you've been 1 week since you've been diagnosed or 50 years. It's great to come in and learn about the disease. Yeah. And then also just get support. It's overwhelming to have this diagnosis. So meeting with a diabetes educator, you just need a referral from your doctor or provider to come see us, and we're happy to meet with you, educate, support you along the whole journey.
Yeah, I'm sure that knowledge and support makes a really big difference for folks.
Yeah, I think so. Yeah.
Well, Sarah, thank you so much for being here. We appreciate it.
Of course. Thank you very much.
Yeah. We'll be right back with a final check of Bill's forecast.